Hi everyone, this is Module Principles of Pharmacotherapy, Chapter 4, which is Medication Adherence. So in this topic, we will look more into the medication adherence and to define compliance, adherence, persistence, and concordance, to identify reasons and factors associated with non-compliance or non-adherence, to discuss the tools that can be used to measure medication adherence, and to discuss the role of pharmacists in ensuring medication adherence. So whenever your patient is taking medications, in order for it to be effective or showing an effect or showing a response in your patients, they need to take the drug. So they need to take it according to the so they need to actually take the drug, and they need to fill the prescription given to them by the physician. So they need to routinely take medication as directed by the physician or the pharmacist. So the quantity should be right. So the quantity taken should be the correct one. So the quantity of the medication taken should be correct. The number of times per day should be correct. The time of the day. So the times of the day should also be correctly taken, so correctly consumed. So the time of the day should also be correct. And they should also refill the medication as needed in order to take the medication as per duration that is being prescribed by the doctor. So in a nutshell, the patients need to adhere to the regimen or the plan that the doctor has planned, and um, to the plan that is given to them in order for it to take effect. So medication adherence is the extent to which a patient acts in accordance with the prescribed interval and the dose of a dosing regimen. So they actually uh, reacts or they act in line with what is being told for them to do, which is to take this medication in which dose, in which duration, in which regular interval. Medication possession ratio. So this is when we want to identify, or we want to know whether the patient is actually adhere or not to the medication. So we can use this formula in which the total days supply in a period divide by the last fill date minus first fill date plus the last fill date supply. So we can get a range between 0 to 1 because it is a ratio, and a total of 1 corresponds to 100% adherence. And it might be possible for the patient to get MPR more than 1 if the patient get an early refill. So they're not supposed to get it yet, but they get it, so the value will be more than 1. And this is the example of calculation. For example, 120 days of supply. So this is the example of the calculation or the diagram showing the patient's tracking of the medication that is being refilled or supplied. And adherence here can be defined, or can be, so the patient can be said to be adhered to certain medication if the MPR value is more than 0.8. However, for medications, for medications like HIV drugs and birth control, may require closer to 100% adherence for it to be effective. So medication persistent here means that, so another term is medication persistent, in which refers to the act of continuing the treatment for the prescribed duration. So it may be defined as the duration of time from initiation to discontinuation of therapy. So it means the patient really adhere to that So that means that the patient, um, so medication persistence. So it refers to the act of continuing the treatment for the prescribed duration, in which it defines more on the duration of treatment itself, from the start of the therapy until the end, or until the discontinuation of therapy. So persistent means the patient adhere to that track of time. So there is a number of days in which um, we allow a gap of the medication taking, and we consider that as permissible gap. So medication persistent is simply means the so medication persistent is simply the denominator of the MPR equation. So it's at the bottom part of the MPR equation, and it used to calculate how long the patient has been taking the medication. And medication persistence is considered to be acceptable if the medication is taken as long as it needs to be taken. And for antibiotics, for example, it should be taken in a 10 days course, but if the patient took it for 5 days, and we know that there is a problem in medication adherence. So stopping medication against or without the advice of the physician or the pharmacist can also be a problem. Another equation here is proportion of days covered, PDC. So it means the number of days in period which is covered by the medication divided by the number of days in the period. So persistent is simply so it results in the PDC, which range between 0 to 1. So the PDC range between 0 to 1, and the value of 1 also corresponds 100% adherence. And adherence is defined as PDC more than 80% of days covered. Medication compliance here, sometimes we use it interchangeably with adherence, but medication compliance here defines as the extent to which a patient acts in accordance with the prescribed interval and dose of a dosing regimen. So it's more like a patient comply to the prescribed regimen of the drug. Medication concordance. So it is actually focused more on the process of consultation between the healthcare providers and the patient, in which rather than the specific patient behavior itself. So it's more on patients' consent to the therapy, and whether they understand the therapeutic objective, the negotiation acceptance, and their commitment to the therapy itself. Examples of non-adherence: failing to get a first prescription or subsequent repeats dispensed. Uh, so examples of non-adherence. First one, failure to get the first prescription or the repeat prescription for refills. Second, discontinuing a medication discontinuing the medication before the course of therapy is complete. Third is to take more or less of a medicine than prescribed. So taking more of the medicine will also um, is also considered as non-adherence. And the last one, taking a dose at the wrong time. So it basically means that the patient do not take as prescribed. So it is actually an elephant in the room, because everybody knows that medication adherence is an issue, but it's really hard to address that. So WHO reports a global medication adherence rate for chronic medications are only 50%, and non-adherence can account to 50% of treatment failures and a lot of number of deaths. And varying So how big is the problem of medication non-adherence? So between 33 and 50% of medicines for long-term cases are not used as recommended. 20 to 20 to 20 to 30% do not adhere to regimens that are curative or relieve symptoms, and 30 to 40% fail to follow regimens designed to prevent health problems. So the challenges here is actually because this issue of adherence are not often disclosed by the patients. So they either they do not tell the healthcare providers that they do not take the medication, or they may even lie saying that they take it even though they're not taking it. And on top of that, this issue is not being recognized by the prescribers or the healthcare providers. The reasons for non-adherence, it might be intentional or unintentional. So they might purposely not taking the medicine, probably of some list of reasons like side effects or the palatability or the or when they think that it's not going to benefit them, so they're not taking, or unintentionally in which they cannot take it due to practical problems or practical reasons. Factors associated with drug adherence or not associated with drug adherence. So there is not there is no evidence showing that these factors might actually predict whether certain patients are going to adhere or not to the medication. So regardless of the age, race, gender, socioeconomic status, education level, the intelligence, the severity of the disease, or the efficacy of the treatment, anyone can any patients can actually be non-adherence, or they can also be adherence. We can really tell. So factors that might influence patient adherence or patient's non-adherence includes the patient variable itself, disease characteristics, treatment regimen, patient-provider relation, clinical setting. So, for example, disease characteristics, if it's chronic diseases, so they're more prone to be non-adherence because of the long-term treatment. Treatment regimen itself, whether the drug is, whether the patient is tolerating that drug or not, whether they can tolerate with the side effects or not. Patient-provider relation, in which the role of the healthcare providers itself, whether the physician or the doctors or the nurses, that might influence patients' adherence. Clinical setting, in which probably the follow-up appointments and whatnot. And probably the follow-up appointments, whether it is being done at the correct interval or frequency. So we need to identify high-risk patients to have this issue of non-adherence. They can be patients with asymptomatic conditions like hypertension or diabetes. There's not really, it's not that. So these diseases are not actually causing the patients to have a very significant symptoms. So in that way, they do not feel that they need to take that medication because they're not feeling anything. Chronic conditions like arthritis, renal impairment, hypertension, this is when the long-term treatment needs to be, so this is when the patient needs to be on a long-term treatment. So that might reduce so that might increase non-adherence. Cognitive impairment, of course, it might increase, it might impair, of course, it might influence their medication risk behavior. Complex regimens, multiple medication, requiring medical aids like inhalers, AccuHealers, so it needs certain techniques for them um, to really get the benefit of multiple daily dosing. Of course, once daily dosing is preferable as compared to 3 times or 4 times per day. Patient perception itself, whether they have poor insight or good insight on the disease itself and the medication itself. Poor communication between patient and doctor and patient and pharmacist relations. Poor communication between the doctors and the pharmacists with the patients. They're not being consulted appropriately on their diseases, on their medication. Psychiatric illness might also influence their behavior of taking medication. So now our role now is, so now we want to, so now how do we know whether the patient is really adhere or not? So we need certain measurement tools to evaluate the the patient's adherence. So these are some of the ways or some of the tools that can be used. First is the physician's assessment. This is subjective. Pill count, so we count the pills during the follow-up, whether they are balances in the pills. Pharmacy refill record, so this is from the medication record from the pharmacy. Drug level monitoring, so this is when we really want to measure the blood concentration, whether it is at the therapeutic range or not. If it's lower, then it might means that the patient do not take that drug at all. So do not take that drug. Electronic drug monitoring, so it requires a system of monitoring for the drug refills, and patient self-report. So this one requires the questionnaires tool that the patient need to answer. So each of these measuring tools or methods have their own advantages and disadvantages. So example of questionnaires that we can use to prompt to get the patient's self-report on their adherence. The popular one is the Morisky scale, MMAS4 or MMAS8. Previously, Ministry of Health has been using this Morisky scale in the hospital setting, but in 2017 it was discontinued. The use is discontinued, and it was substituted by the Malaysian MAAT. So the questions are actually very simple. It just asks the patient's regular habit or regular um, drug intake every day. For example, do you take your medication? So do you take your medication as directed? Have you ever missed your medication? So if you miss your medication, do you double? So if you miss your medication, so how frequent do you miss your medication? If you travel, do you take your medication with you? So this type of questions. There are limitations in drug adherence measurements. Several ways to measure is through data, through claims data, and sometimes so there are limitations in some of the medication measurements or tools. For example, the ones using the calculation, it might not represent the actual thing that happened. So the data might also wrongly represented using these calculations. For example, when the patient have early refill, or when the prescription has been changed, so these things might this thing might not be captured in the calculation or in the equation. So the best way is actually uh, to discuss with the patient about their medication taking behavior. So what is the role of a pharmacist actually in improving patient adherence? Of course, medication counseling would be our main role as a pharmacist. So we can help patients to develop an understanding on their treatment, on their diseases, and the challenges that they might encounter during the treatment. To prepare the patients to initiate the treatment, so they need to be empowered, or they need to be educated in order for them um, to really perceive that the medication is going to help them. In that way, they will subsequently adhere to that medication. So counseling might also provide ongoing support for the patient over the long term, and it will develop good treatment taking behavior, and it will help the patient to set the goal for their treatment. So strategies to improve adherence, there's a list of them. Um, we can establish readiness to start the therapy by counseling itself, provide education, review the potential side effects, identify possible identify any contraindications in the treatment given, um, uh, educate them on the possible side effects that they might encounter, utilize all the educational aids or tools that they can access, like pill boxes, calendars, or any medication taking apps that they can use according to their preferences or their ability. Engage with family and friends to ensure a good support system. Simplify the regimen, dosing, and food requirements, so we help them um, to do the planning for their medication taking. Utilize team approach with nurses, pharmacists, and peer counselors, and we provide, or in overall, we provide the accessible and trusting healthcare team together with the patient, because the team is because the patient is the center of the care in health, in pharmaceutical care. The patient is the center of the care, and have to work together with them. As a conclusion, medication adherence is actually a big burden to healthcare resources and cost, and it is an ongoing issue. Reasons and factors associated with non-adherence need to be evaluated by the pharmacist doing drug therapy assessment, and we can use many tools to measure medication adherence, but each of them have their own advantages and disadvantages. And last but not least, pharmacists plays a very big role in ensuring medication adherence, especially through medication counseling. So with that, thank you very much.